Welcome back. Once again, my name is Dr. Jay Bowen, and I work at New Jersey Regenerative Institute with the hope of treating pain with non-surgical or regenerative medicine. I previously did an overview of spinal issues, and this is the beginning of our 5-part series of the more common spine issues that you'll encounter. Starting off, we have one of the most common causes of low back pain, sprains and strains. In medical terms, a sprain is when a ligament has been overstretched or torn, while a strain is when a muscle or tendon is damaged. Now, a lot of people, and even some doctors, brush this off as not really a big deal, but they can really hurt a lot. And they can often come back if you don't treat them right. Most folks will rest or maybe ice, heat the area, and try some stretching. If it gets bad enough, they might have to see their doctor. Most people have heard of RICE, or rest, ice, compression, and elevation. This doesn't really apply too well for the lumbar or low back region, and it's more of an outdated thought process anyways. MEAT, for movement, exercise, analgesia, or pain relief, and treatment facilitates recovery. You might get prescribed a muscle relaxer or something for the pain. However, muscle relaxers don't really affect the muscle so much as they just make you sleepy because they work in the brain. Physical therapy is commonly recommended. But there's something important. I usually recommend avoiding non-steroidal anti-inflammatory medications like Advil, Motrin, Aleve, Naproxen, or ibuprofen. Why? Because they can shut down the body's natural healing response. So what you need to really watch out for, though, is progressive leg weakness or a sudden loss or impairment in your bowel or bladder functions. Like you can't pee or poop, or you have an accident and you didn't even realize it. That can mean pressure on your spinal cord, and that's an emergency, so head straight to the emergency department. So, up to this point, we've talked a lot about chronic overload and why mechanics matter. But there's another piece that people don't talk enough about: acute injuries. Things like a sudden fall or whiplash from a fender bender. Those are real injuries. And while they often improve with time and standard care, they can leave behind this lingering mess of symptoms. You feel mostly better, but not quite right. And so many people just decide to live with it. Here's the deal. Low back pain is a leading cause of disability, and not just here in the United States, but globally. And if you're someone who keeps having recurrent, severe, or just plain stubborn episodes, and nothing's worked, there's probably something that's being missed. In most cases, the underlying issue is the impaired mechanics, or how you load and use your body, has not been completely addressed, or there's just incomplete soft tissue healing. Now, sometimes the answer is more focused physical therapy. Other times, it's just about doing the right exercises with real consistency. And yes, exercise success comes down to 5 things: technique, 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 technique. And guess what? Nope, not technique, discipline. If you've been showing up, doing the work, and still not seeing a change, it might be time for something called a functional movement screen. These screens pick up on subtle asymmetries in strength or flexibility that can throw everything off. And trust me, our bodies hate imbalances and asymmetries. If movement alone isn't cutting it, then we're starting to talk about regenerative treatments, since the issue is not fully healed. I use prolozone, which is an anesthetic with some ozone combination, or PRP, platelet-rich plasma, that comes from your own blood to help modulate your inflammation and stimulate healing. They're done in the office with local numbing, sometimes with ultrasound or fluoroscopy, x-ray, to guide it to make sure we're right in the exact spot we need to be. Look, back pain is common, but staying stuck with it, well, that part's optional. If your treatment plan hasn't worked, it's not the end. There are solutions. You just need to get the right team and the right strategy. I hope this helps shed some light on what might be going on with your back pain. If you're enjoying our content and information, please go ahead, hit that like button, subscribe, and feel free to share this with a friend or family members who are struggling. Unfortunately, too many people are walking around in pain and they don't need to be. Let's change that.